Parenthood is the scariest hood you're ever gonna go into. I love that quote. I also love the quote, every mom is different and every mom is right, which plays into today's video pretty well, because what I wanna share with you is something that I've been dying to share with you guys for years, ever since I started my YouTube video. I think it's such an informative tidbit to know as you enter parenthood, or even if you're a second or third time mom, maybe you don't know some of these things. These are 10 decisions that you need to make when you bring a newborn into the world, because you are that baby's advocate, as you very well know. So a lot of people talk about pregnancy and the birth experience, but not a lot of people talk about, or at least not in my realm, talk about all of the decisions that you need to make for your newborn almost immediately after giving birth, right? And there's so much going on in that moment that you need to make these decisions beforehand. Otherwise, your doctors or nurses or whoever will kind of make them for you. And we can't always trust those doctors and nurses. So, I mean, you can to a certain extent. Do your research. I'm gonna say that probably multiple times throughout this video, but I'm going to just kind of spitfire 10 decisions that you need to make, and I have my notes. So here we go. So the very first thing is delayed cord clamping. This happens almost immediately after you give birth. It's the very first thing, the very first decision that you need to make right after your baby comes out of you. You know what I mean? Why should you do it? Why might you want to wait? And what is it? So delayed cord clamping is basically delaying the cord clamp. Pretty self-explanatory. Many doctors and OBs, they kind of do it right away. I think it's becoming more of a thing where they delay it, but I can tell you from experience, even if you ask them for delayed cord clamping, it's kind of second nature to them to clamp it right away, because that's just, they're doctors, they're busy, they're like, okay, let's get things rolling. And so you have to kind of make sure that they know, delay the cord clamping, because there are benefits to this. I think it's 1/3 of the baby's blood is still pulsing through that cord from the placenta to the baby. So the best thing to do for your baby to get all that blood circulating back into his or her body, to make sure that they don't get jaundice. What's another benefit? It can also protect the baby from getting anemia and irregular breathing patterns for weeks or months after being born. So I think it's really important for the cord clamping to be delayed. I think science explains this delayed by like 4 minutes. I mean, you can wait as long as the doctor will wait. So delayed cord clamping is waiting 4 to 10 minutes after giving birth. Some people choose to wait after the placenta has been birthed, or when the cord stops pulsing. Some people opt, this happens very often in home births or maybe birthing center births, where they have a lotus birth. And that means the umbilical cord from the baby is attached to the placenta until the umbilical cord stump falls off of the baby. So this can happen 3, 4, 5, I mean, maybe a week after birth. But I will say, I think during my research, I think it's more prominent for the cord stump to fall off quicker if you get delayed cord clamping. One reason you might want to cut the cord early is if you are choosing to store the blood, the umbilical cord blood. Because of all of the stem cells in the cord blood, which is why a lot of people choose to bank that cord blood, there's potential to treat like cancers and different kinds of blood, immune and metabolic disorders. So if you're choosing to have that blood stored, of course you're going to want to cut it right away so they can get as much of that blood out of the cord to store it. And I also want to remind you and kind of emphasize this, that a lot of these decisions can be made whether you're giving birth naturally or with an epidural, or if you have a C-section. You just have to tell your doctors and nurses that this is what you want. The second decision you have to make is washing, weighing, swaddling immediately versus kangaroo care. So what is the difference? Kangaroo care is what a lot of hospitals I feel like are moving toward these days, and that is like skin to skin right away. Like after you give birth, the baby comes to you skin to skin. So there's a lot of benefits for that, for breastfeeding, for normalizing breathing patterns, temperature. What else? Okay, I'm reading my notes. It says, the mom's voice is so soothing because you guys have just been through a very traumatic experience, both mom and baby. This baby is coming into this brand new world, and of course they want something familiar. Do you know what I mean? Someone that they love very much, their mom. So it's very beneficial for both mom and baby, because obviously mom just delivered a baby, and of course you want that, you know, the baby's been growing inside of you for 9 months. You want to hold on to this prized treasure. So it's beneficial for both of you, the hormone levels and everything like that. And in my notes, I'm talking about like a sensitive window where there's a 2-hour time frame where the baby nurses for the first time, and there's just this like a baby moon that happens, you know what I mean? Everything's very calming and new and fresh, and you kind of want to make that time as peaceful as possible. And all of the stuff that the nurses do, you know, wiping the baby down, which isn't on this list, but oh, what's that stuff called? The vernix on the baby's skin, that's really good for them. Keep it on their body as long as possible. So I would even opt to delay the bath, but that comes later. Okay, what we're talking about now is like weighing them and the, what's it called? The APGAR scale, the like 1 to 5, where the nurses like look at the baby's color and rates the baby on this APGAR scale, right? All of that can be done while the baby is snuggling with mama. The nurses, like I said, wipe them down, give them a clean blanket, measure them, weighing them, you know, they can take them away briefly after the kangaroo period. Or you can opt out of the kangaroo care and have the baby weighed and all of that in, you know, a little corner right away. And why might you want to do this? Maybe you had a C-section or you're on pain meds, and you know, you're just kind of coming to, or maybe you had a very traumatic birth and you just need a minute to like pull yourself together, you know what I mean? A lot of times the mom needs stitches, and this could be a good time to have someone else care for the baby or have the APGAR. Is it even called APGAR scale? I'm like probably saying it wrong, hold on. APGAR scale, okay. Anyway, what was I talking about? If you've had a C-section, maybe someone can bring the baby to you face to face. I see that a lot in like newborn pictures when I see the mom who has just had a C-section. And with that, some of the moms who have just had a C-section, whether it's emergency or not, sometimes they're not physically able to, like, you know, handle their newborn right away because their body's just been through so much. But if this isn't an option, a lot of times they'll hand the baby over to dad or another caregiver, someone else, and skin to skin is very good in that sense as well. Okay, decision number 3, we're moving along slowly but surely. Here we go. It's the prophylactic eye ointment, and this is like that goopy stuff that you see in almost every newborn picture, because in a lot of states, this is just a common procedure. And what a lot of people don't know is that you can opt out of this. Some states, I think it's mandatory, but in a lot of states it's not. It is regular procedure for them to just do it for precaution, but it is your choice. You can opt out of this. Why might you want it and why not? Let's get into that. So it is usually administered within an hour of giving birth, and it is an antibiotic. The intention of this eye ointment is to prevent newborn from getting blindness after birth if the mother has gonorrhea, which can be passed on with a vaginal birth delivery. And I think it can also, if you have chlamydia or herpes as well, it can also be passed to your baby. So if you have one of those 3, I think they're all STDs, you would obviously want to opt to have your baby get this eye ointment. But you can opt out of it if you know that you don't have any of those STDs, to kind of save your newborn, soft, squishy baby from having antibiotics on their eyes like an hour after they're welcomed into this world. And you can opt out of this if you're having a C-section, because obviously vaginal delivery, it's not going to really transfer in the same ways. Okay, and in my notes, I just added, make sure you get tested for STDs. Sometime during your pregnancy, get tested for STDs so you know whether or not you need to give this ointment. Okay, number 4 decision is the Hepatitis B vaccine. And the CDC recommends that all infants receive the Hep B vaccine before leaving the hospital after birth, then receiving 2 more doses. That's what they recommend, but it is your choice to decide whether or not to give this vaccine to your newborn baby. Why might you want the shot? Here we go. If you have the hepatitis B, which is a serious infection of the liver, you probably want to do everything you can to avoid your baby from getting this. Why might you want to opt out of it? Obviously, if you don't have it, there's a very low risk of your baby getting it because it is an STD, and I think it's a bloodborne pathogen that can only be passed through blood. So like if you're sharing needles or something like that. So it's very low cause that a baby is going to get this unless mom has it. So you might want to delay that vaccine until later in life. This is a vaccine that is required for schools. Okay, decision number 5 is the hearing test. I did not know you could opt out of this, which My first baby failed the hearing test, I think only on one side, and then they tested it again before we left the hospital and she passed. So, and her ears are fine. But hearing, I think, is one of the most common birth defects, affecting 3 out of 1,000 babies. The screens are non-invasive and they're rather inexpensive. I think they're from like $10 to $50 depending on what hospital you're at, where you live. Why might you want this? If it's caught early, if hearing loss is caught early, it could be treated and maybe won't have an extensive effect. Why might you want to opt out? Maybe this is something that you want to monitor on your own and see as the child grows. So I wrote in 14 states, this is an option. So I guess in some states, it is mandatory to have your baby tested for hearing. And then in other states, 14 states, I didn't write the ones. Sorry, my notes are not that extensive. Oh, I see. Okay. So many notes, so little time. So sometimes they give the baby a sedative in order to perform this test. So what you can do, your options are to wait until the sensitive window has passed, which is like the 2-hour, you know, skin to skin, like, oh, everything's new window, which generally I think the test is done, at least in my experience, a day when the baby's a day old. So the sensitive window has passed. You can wait until a certain time to have the hearing test done. You can say, oh no, it's not a good time right now, baby's crying, come back. You know, maybe wait until after a feed when the baby is sleepy. So of course, still have options. Ooh, okay, number 6, the heel prick. And this one got my husband because, you know, it's like a newborn baby right away and someone's coming in with needles, sticking your baby's heel and drawing blood. So it can be quite traumatic for mostly the parents, not so much the baby. Well, the baby too, because obviously one of the first sensations they feel in the world are like, all these needles. Okay, so babies usually have a single heel prick to draw a drop of blood or two, which is put on a certain type of paper that they send to a lab, and the blood is tested for 20 plus inherited metabolic disorders, which is a lot of disorders to test for with such a small amount of blood. So it includes PKU, cystic fibrosis, and sickle cell anemia. Ooh, some states recommend 2 tests, one immediately after birth and then one right before you're discharged from the hospital. Why might you want this? Obviously, if any of those diseases run in your family, one of the 20, so go research exactly what 20 they screen for. But if any of those run in your family, of course, you would want to get that screening tested. And some people look at the small little prick on their heel, worth it for as many things that they screen and test for. Why might you want to opt out? A lot of the diseases that they do test for are pretty rare. And the blood screen's rate of false positives are relatively high, apparently. And then, of course, making parents receive news that their child needs furthermore testing, which can sometimes be invasive, which can cause more stress on the baby and parents, which can end up being false. Does that make sense? Okay, so additionally, some of the disorders have no treatment or cure, or have variations in forms, which may require no intervention at all. But maybe it's good for you to know. And of course, these tests could be delayed. You know, you can wait a few days after birth or even more than that. If you do it, make sure the baby's foot is warm, so there's a lot of blood flow there, so they don't have to prick them multiple times, because that has happened to me as well. Okay, decision number 7, that is a 2. But what I mean is 7, the vitamin K injection. And this one I struggled with for a long time, so let's get into it. Okay, so what is vitamin K? Why does your baby need it right after being born? Vitamin K is a fat-soluble vitamin we get from bacteria in our gut. It's also in leafy green vegetables. It's crucial in blood clotting and bone health, which is very important for new babies to be able to clot their blood. Babies are born with lower clotting factors than adults, perhaps because their intestines lack the bacteria which provide most of ours. A vitamin K deficiency can lead to vitamin K deficiency bleeding, which is severe bleeding, which a lot, I think, happens in the brain that goes undetected. Also an important one to have if you do plan to have your baby boy circumcised, which I will get to at the very end, but we're on the vitamin K shot right now, because obviously you need that baby's blood to be able to clot so they don't lose too much blood. Okay, bleeding in infants due to vitamin K deficiency can be severe, leading to hospitalizations, blood transfusions, brain damage, and even death. While formula is enriched with vitamin K, breast milk tends to be lower in it. But if you are breastfeeding, you can always add vitamin K drops to your diet to make your breast milk more rich in that vitamin. Okay, now, why might you want to opt out of getting this shot that is so amazing and can help the baby's blood clot and, you know, possibly prevent death? Yeah. So many of us question, well, why would the baby be born with a vitamin K deficiency right off the bat? You know what I mean? If this baby is so wonderfully and beautifully made, how could they possibly have a vitamin K deficiency immediately after being born? So that's why some people opt out of it. And then, like I said earlier, some people, women who are breastfeeding, they up their vitamin K intake to make sure that the vitamin K is in their breast milk, getting into their baby. I think there's also vitamin K drops that you can give to your baby. Oh, and bonus, colostrum, which is the predecessor, which precedes breast milk, which comes first, is high in vitamin K for this very reason, which is another reason, oh, God made these babies and it's just a miracle. And how does our body know to produce this colostrum, which is high in vitamin K? Okay, another reason I'm hung up on the vitamin K, because I did not get the shot for Wentworth, my third born, and I was going through a mental breakdown thinking about it every single day. I know vitamin K is given to a lot of babies, mostly hospital births, because they don't know what's gonna happen on their way home. Oh my gosh, are you gonna get in a car accident? Is the baby's head gonna smash and then a brain bleed and not be able to clot? And I kept thinking that every time I went somewhere with my baby, and I thought, oh my gosh, I didn't get him the vitamin K shot. What if he bonks his head and just break? Anyway, so I will say, for peace of mind, next time around, I will probably make sure my fourth baby, if that were to ever occur, I will probably get them the vitamin K shot for peace of mind. Even though all of these options not to get it are obviously very persuasive, because I chose against it with my third. So another reason not to get it is the vitamin K shot injected is a very high dose. It's 20,000 times the level present at birth. And lastly, high vitamin K levels are a cause of jaundice in newborns. So there you go, make an informed decision. Make sure you go research more if you have any more questions. Okay, decision number 8, sleeping arrangements. Many hospitals now offer rooming in, and I feel like back in the day they used to kind of take the babies to the nursery. You know, even in like the older movies and stuff, you'll see the dad like kind of seeing the baby for the first time through a window, like into this nursery. Do you know what I mean? But now it's very common for the baby to sleep in the same room as mom. It's just more convenient for mom to breastfeed or something like that. But why might you prefer for baby to sleep elsewhere? So there are a lot of reasons why a lot of moms want the baby to be in the nursery. Obviously, nurses are going to be watching after your newborn while you recover. You just went through an exhausting, you and your husband really, or whoever's with you, you mostly just went through a labor, which is exhausting, whether it was a C-section or vaginal delivery, whatever. It's exhausting bringing a baby into this world. So you might opt to have someone else while your baby is resting. You can rest if they need to eat, if you're choosing to bottle feed, that kind of thing. You know, someone who is trained in this expertise is going to be looking after your baby. A lot of people are choosing to have their babies stay in their rooms nowadays. Like I said before, it's more convenient if you're breastfeeding. A lot of times when they're in the nursery, they are bottle fed, although I'm pretty sure you can tell them, hey, I'm breastfeeding, don't offer a pacifier, and bring the baby to me when they're hungry so I can nurse. Because the baby's stomach, when they're brand new, squishy little newborns, their stomach is like the size of nothing. So it takes very little for them to have a full belly, and you want to get all that colostrum in them as you can. So yeah, anyway, a lot of times, and plus there's so many procedures, you want that baby to be by your side. And I don't know, for me as a mom, I couldn't keep my eyes off of my newborn, just staring at them, making sure they're safe, knowing that there's no switched at birth situation happening. Do you feel me? Okay, number 9, artificial nipples, pacifiers, or bottles. Why might you want pacifiers? Well, newborns love to suck. And let me tell you something, 2 of our babies would not take pacifiers. And I always said that I was their pacifier because I nursed all of my babies, and they wouldn't take an artificial nipple, but they were a feel like always attached to me, so I was their pacifier. So some moms want that independence. They want just a little break when they know their baby is fed, their baby is burped and clean and all that stuff. They might want to introduce a pacifier to soothe them. That is the only way a baby can soothe themselves, really, is through the suckling. So a pacifier is a great option for that. So why might you want to avoid this? Well, a pacifier is a very hard habit to break. As they get older and older, they will become dependent on it in a certain sense, like maybe they need it to go to bed or something like that, much like sucking their thumb. Do you know what I mean? Why else would you want to opt out of artificial nipples? Maybe if you're breastfeeding, lactation consultants like to say that to keep those away for a couple of months while your baby gets in the habit of nursing, to avoid the nipple confusion kind of thing. Breastfeeding is a challenge. So if you are on that journey, taking out that like artificial nipples is just one less thing to worry about for you and the baby. So for me, this is something that I opted out of, and I would rather have the baby suckle on me to, it also encourages your milk supply as well, so that's not a bad thing. And of course, it doesn't always have to be one or the other. You can also like limit the time the baby has the pacifier and that good stuff. Always make your own choices and do what's best for you and your baby and your family. And the 10th decision, the last one that I'm gonna talk about today, and I can make more videos on this topic if you want me to, because I just love babies and birth and the whole experience, you know what I mean? So the last decision that you have to make is time of discharge, and believe it or not, you have a say in this as well. So most hospitals keep mom and baby for 24 to 48 hours, some even longer, 72 if you've had a C-section, they'll keep you a little bit longer. If there is some kind of complication, they'll keep you longer. But generally speaking, most hospitals I think nowadays are even just 24 hours and you're out the door, so they have room for more patients. The Business of Being Born, have you guys seen that? If you haven't seen that documentary, check that on. I'm pretty sure it's still on Netflix. It is a fantastic documentary. Okay, so why might you want to stay? There are some, I think, maternal complications that can occur, especially with the placenta. I know sometimes women have still a piece of their placenta inside of them, which can cause an array of issues, which are very serious. But sometimes those problems aren't detected for a day or two after birth. So stay in the hospital setting and make sure someone is taking after you and caring for you to make sure that you are all safe. Why might you want to leave right away or as early as possible that they would let you? Obviously, hospitals are dirty places. There's germs all over the place. Second of all, who doesn't want to go home in their own comfy bed? Third of all, hold on, let me rewind back to why you would want to stay. They feed you, which is my favorite part always of giving birth, is someone is taking care of you and someone feeds you food that you don't have to cook yourself. It's amazing. It's one of my favorite parts of the postpartum experience, because let me tell you, after you give birth, that postpartum time, I call it the 4th trimester, which I really want to make a video about, is the hardest time. Anyone agree with me? Okay, so in my notes, I put, postpartum doulas. If you haven't heard of them, make sure you check them out because they're amazing. They'll come to your house, they'll clean, they'll go grocery shopping, they'll watch the baby while the baby sleeps or while you sleep, while you take a nap. They're amazing. Amazing. They're specifically trained to care for newborns and their mamas, and there's a lot of them available these days, so Google it in your area. And I know this is true in birthing centers where you go home, you're discharged within like 6 hours after giving birth, and then either the midwife comes to you or you go back to the birthing center like a day after you deliver just for a check-in, make sure everything's okay, and then you go back home in the comfort of your own home where you are probably going to recover quickly. Or more quickly, maybe. Not if you have to make your own meals. Okay, and the last one, a bonus, number 11, is if you're having a little boy, circumcision. You have to make the decision whether or not you're going to circumcise. That is a topic for a whole other video that I won't get into here, but I will encourage you to do your own research, and I don't want to make anyone mad, so that's all I'm going to say about it, okay? Thank you guys so much for watching and hanging out. I hope this was informative for you. If you have any questions, I am not a certified anything, but I am a certified mom of 3, and I love the birthing experience. I work with moms who have given birth almost every day. So I love the birthing process and the birthing experience. So if you have any questions for me, I'll be happy to answer them below. So thank you guys again for hanging out, and I'll see you next time. Bye.